The brain, our body's command center. Your brain is the command center of your body. It controls everything, your thoughts, movements, memories, and even your heartbeat. It works day and night to keep you alive and aware. The brain has three key missions. Control. It tells your body how to move, speak, and react. Process. It makes sense of what you see, hear, and feel. Protect. It keeps your heart beating, lungs breathing, and body balanced, all without you thinking about it. But sometimes an abnormal growth called a tumor can form in the brain. Tumors can be slow or fast-growing. They press on healthy brain tissue, disrupting its work. Depending on where they grow, tumors can cause headaches that won't go away, trouble speaking, seeing, or remembering, weakness in arms or legs, seizures, or sudden confusion.
Hi, I'm Dr. James Mercado, one of the neurosurgeons here in Davao Doctors Hospital. So what is brain tumor, or yung tinatawag nating tumor sa utak? So these are abnormal growth of cells in the brain, and they are divided into two. It could be a benign one, or a benign tumor, or a cancerous or a malignant one. If left untreated, as I've said, it would increase the severity of the symptoms, and it may lead to life-threatening complications. But for malignant tumors, one complication is what we call metastasis, or yung pagkalat ng tumor cells sa ibang parte ng katawan. And so that's a complication for malignant tumors. So what are the symptoms of brain tumor? So these patients na merong brain tumor may present with these type of symptoms depending on the location, kung saan banda ng utak, and the severity or gaano kagrabe yung brain tumor. So they may present with headache, panlalabo ng paningin, they may present with seizures or convulsion, or panghihina ng katawan. And if left untreated, these symptoms may increase in severity and may lead possible to life-threatening complications.
A brain tumor is never something to ignore. Without treatment, what starts as mild symptoms can turn into life-threatening problems. Let's understand why early action matters. An untreated brain tumor keeps growing. As it expands, it presses against healthy brain tissue. Headaches become unbearable. Nausea turns constant. Simple tasks feel impossible.
So how do we manage brain tumors? So I'm a neurosurgeon, so one treatment plan is actually surgery. So basically, we physically remove the tumor in the brain. And so we do craniotomy, open the skull, and surgically, microscopically remove the tumor. So these are for benign tumors, especially. This may lead to a cure for patients for benign tumors. But however, for malignant tumors, it should be a multidisciplinary approach. So it would include us neurosurgeons and our colleagues from medical oncology and radiation oncology.
Radiation therapy is commonly used to manage brain metastasis as it can prolong survival and provide relief from headaches, dizziness, and other neurological problems these metastatic tumors can cause. There are two ways to deliver radiation for brain metastasis. This is delivering a whole brain radiation, and the other one is delivering stereotactic radiosurgery, or what we call SRS. In whole brain radiation therapy, it is self-explanatory in that the entire brain receives radiation. This is still a good standard of care and treatment which is still acceptable, especially for patients with multiple brain metastases.
Modern medicine offers real solutions. Surgery, targeted radiation, and new therapies can stop tumors in their tracks. The earlier it's caught, the better the chances. Your brain is resilient. With the right care, it can heal.
Treatment often involves a combination of therapies tailored to the individual patient's situation. A multidisciplinary approach that combines systemic and local therapies such as surgery, radiation therapy, and systemic treatments like immunotherapy and targeted therapies is highly recommended because the goal of treatment is not only to extend survival but also to improve or maintain cognitive function and overall quality of life.
So this would be my advice to our patients. If you experience this type ng mga symptoms like headache, blurring of vision, seizures, and the other things, it's better to consult your doctor. It may be a neurologist or a neurosurgeon for this matter. And for our patients na who underwent surgery and multidisciplinary treatment, it is better for you to really have a constant and regular follow-up with us, your doctors, so that we can manage, if ever there are post-operative complications or side effects, we can manage them, manage natin properly, and we'll be able to help you.